Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We are pleased to welcome Dr. Vernon Williams, an emergency medicine physician and owner of the Wellness and Aesthetics Medical Center based in San Antonio, Texas. Welcome.
Thank you very much, Phil.
You've been involved with A4M for quite some time now. Will you share with us your journey with A4M from first learning about the organization to today?
Well, the first time I learned about A4M was in 2008. At that time, I came to one of the conferences right here at Venetian. And after sitting through the General Assembly, I was really shocked at all the information I learned. So I walked to the front desk and I signed up for the board certification course. So I signed up for that. And then over the next 3 years, I took the modules, and then I took the exam, and then the oral boards, and became board certified. I also did the fellowship training with them. As a matter of fact, I go to seminars all the time with A4M. I probably go to 3 or 4 seminars a year. And now I'm also an oral board examiner with them. But you know, what's really incredible about the A4M is that they have so much to offer. I mean, I've done the fellowship in stem cells, in sexual health. I've also done the fellowship in alternative cancer therapies and sports medicine, and also the peptide fellowship. So if you think about it, I've probably done over 30 different modules.
Wow.
in the A4M.
So you've experienced your own medical emergency after being diagnosed with a serious medical conditions years ago. How has your experience as a patient informed your approach as a physician?
Well, first, as an emergency medicine physician, we practice prescription medicine. You have a headache, you got diagnosed with Tylenol deficiency, and you got Tylenol, and that's where you were treated. In 1991, I started gaining weight. When I was in high school, in the 11th grade, I was 5 foot tall, and I weighed 100 pounds. In my senior year, I put on 10 inches of height and 50 pounds. And so I was always like 5'10", 150 all through college and through my first few years of medicine. And then in 1 year, I put on almost 100 pounds and I blew up. So I went to see my endocrinologist, and he diagnosed me with a pituitary adenoma, prolactinoma. And he put me on some medications. 10 years later, I was 290. I wasn't getting any better. And so that's when I started looking for alternative ways of taking care of medicine. That's when I started looking for things and started looking into regenerative medicine. The solution for me was more in optimizing my hormones and my nutrition and sleep. And so those all came together to help me optimize my body.
What past educational experiences have had the most long-lasting effect on your practice?
I think when I came here in 2008 and I experienced the General Assembly, because, they talked about things that I never knew existed. I really like the regenerative medicine because, that is something that we don't even think about. Let me give you an example. Let's say you break a bone in your forearm, and you go to your orthopedics doctor. He puts a splint on and he says to you, in 6 to 8 weeks it's going to be better, and he's gone. What is happening in that time frame? Well, what's happening is your body is actually regenerating the bone, the cartilage, the tendons, the muscle. Your body is actually fixing the problem, not the orthopedic doctor. You get a cut. We put a few stitches in it. The stitches are just to pull the skin together. But underneath all that, your body is regenerating itself. And if you can help your body regenerate itself, you can actually do better. How do you do that? By nutrition. You know, in medicine, we don't even learn about digestive enzymes. But do you know, after age 40, we all need digestive enzymes? Because without digestive enzymes, you cannot digest anything. So when you put food into your mouth, it has to be broken down by digestive enzymes to become microscopic enough to get into your body. Once it gets into your body, those same digestive enzymes go about putting it together to make things. For instance, let's say that you ate a protein meal. The digestive enzyme and hydrochloric acid is a digestive enzyme. It breaks down that protein into amino acids. They get into your body, then those same digestive enzymes take the amino acids, they put them together brick by brick by brick to make hormones. Like, for instance, growth hormone, 191 amino acids put together to make growth hormone. They put them together to make testosterone, to make your bones, to make your cells. That's digestive enzymes does all those things. And our bodies make digestive enzyme. We just don't make enough after 40. So if you have grandparents in nursing home and stuff, they should all be on digestive enzymes. That's one of the things that's very, very important. Another thing is something like nitric oxide. You know, that's the stuff that your cells that line your arteries make. You know, as you get older, those cells make less nitric oxide. Nitric oxide is what cleans your arteries, keep them nice and open. You know, I say to everyone, when you're 20, your arteries are 10-lane highways. By the time you get to 60, you're down to 3-lane highways. You optimize your nitric oxide, it opens up those arteries so that now your arteries, which are carrying your food, arteries carry food. The Walmart truck, the HEB truck can fly down the arteries at 90 miles an hour to get to that toe cell that needs that raw material. And so those are the two very important things that everyone over 40 should be on. You never hear that from anyone. But we look at all the little things that we miss out on to help optimize our bodies. For myself, one of the best anti-aging things is exercise. Unfortunately, I don't like exercising. And there are lots of people who don't like exercising. But exercise is probably the best drug for you. It's cheap. You can do it anywhere. You don't need a gym. You can do it anywhere. Exercise and sleep are two tremendous things that you can do. Now, let's talk about sleep. You know, when a baby is born, a baby sleeps about 20 hours a day. Now, why is that? Because 95% of that time, that baby is in REM sleep and deep sleep. Deep sleep is when the baby fixes things in the body, grows. REM sleep is when the baby stores information. That's why babies remember everything they see and learn, because they store it in REM sleep. And they sleep with 20 hours a day. When you get to be 60 and you sleep in your 6 to 8 hours a day, you only have about an hour's worth of deep sleep and REM sleep. And because of that, you don't spend enough time cleaning your body and fixing things, because you don't spend enough time in deep sleep, and you don't spend enough time in REM sleep to store all the memories you've learned. So exercise and sleep is very, very important. Then nutrition. You know, I tell everyone that, you know, your body is made of cells. For instance, your skin is made of skin cells. They live about 30 days and then they die. So every 30 days you get a new skin. But it's not just your skin cells. Every single cell in your body has a lifetime. Like, for instance, in your blood, your red cells live 1 week and then they die. Your white cells live 6 months. Your bone lives a year. So every year, technically, you get a new bone. And if you can give your body better raw materials, every time a cell divides into another cell, makes a new cell, the new cell can be better than the one that died. And when you do that over time, you'll make your body healthier. When you exercise, what are you doing? You're ripping up your muscles. And you are making new muscles by ripping up your muscles. And so you want to make sure that after you exercise, you give your body the right raw materials so that when the new muscle cells are made, they can be better than the one you just ripped up. So these are all kinds of things that you can do to optimize your body nutritionally.
Well, I know you have to get busy with your exams, so I appreciate you taking the time to join us today.
Well, thank you very much.